but it's kind of like Gould Dolan's work showing that there's kind of this critical period where they're effective. And so that's how we view their activities in regulating inflammation. So, in other words, some of the work we found is that on certain genes, psychedelic in immune cells, let's say, psychedelics don't really have an effect. So there's really not direct modulation. Yet, if you co-administer other compounds, like in our case, we did corticosterone, the stress hormone, or we did inflammatory cytokines, things like that, then there's this critical window of signaling that's engaged. And within that window, psychedelics are effective. And in some cases, if you go beyond that, so if you dial the system too high or too much inflammation or too little inflammation, let's say, psychedelics don't have this kind of anti-inflammatory property. That's kind of like how we
Hmm.
interpret it.
Hmm.
Yet, if you use them in the right window where either a tissue is dysregulated or cell signaling is dysregulated, that is when they actually exert beneficial effects. And so we're really interested in that concept because we think it lies within intracellular signaling and how coincident signals prime cells to be in a certain state where engagement of these pathways activated by psychedelic would be effective. So I think broadly that's sort of how we view it, if that sort of explanation makes sense.
Yeah, yeah, I think it does. And so if I tie some things together here for people, so Gul Dolan's work's very interesting. I've had her on the podcast. And so I'll sort of articulate how I think she would describe her work and basically how you just did. And there's sort of there's some controversy in the field right now and some different ways of thinking about this. But one way that some people think about psychedelics is that, okay, we see these neuroplastic changes, we see these potentially therapeutic changes. One way that some people think about that is the psychedelics themselves are inducing the plasticity per se and having all of these effects. Gould Dolan's work starts to say, well, actually, it's not quite like that. These psychedelics are opening, they're more of a permissive signal. They are creating which metaplasticity, so they're enabling plasticity to happen if it's stimulated in a critical window around the time the psychedelics are administered to induce the plasticity and the circuit change and things like that. So it's this somewhat subtle difference in viewpoints. And what you're starting to say sounds like it's kind of similar to what Gould Dolan has seen, whereby you can induce a sort of metaplastic shift with something like a psychedelic, and then another compound, another environmental factor can impinge on the nervous system, and it's rendered more effective at driving change when it's used in conjunction with the psychedelic window that opens.
Yeah, I think that's sort of how we view it. I mean, the way I was trying to state it from the perspective of how the compounds would be acting on immune cells or immune cell signaling or even like tissue physiology more broadly. But that is kind of how we sort of view it, which is there are these kind of coincident signals, at
Mhm.
least in something like primary immune cells or tissue responses or some aspects of behavior. But there's obviously no doubt that there is also this induction of things like new spines or something like that caused by psychedelics. But it seems that when we use them in in immune cells, or at least to target immune tissues, it's the tissue already has to be at a certain state. And sort of what I meant by that is when we would treat animals with these compounds, the animals had to already have dysregulated, let's say, meningeal immune responses in
Mhm.
order for psychedelics to reduce the abundance of immune cells in the meninges. And it also appears to be specific to certain tissue states. So in the context of stress, what we saw is, if you administered psychedelics to animals that underwent chronic stress, but then looked at their spleen, there really wasn't so much different in response to psychedelic treatment. So it seems to be, at least on the tissue level, is kind of how we're thinking about it. There seems to be this tissue dysregulation that needs to have happened. And I assume there's an upper and a lower bound. That's why I call it a window in my head, for these compounds to be effective at reducing it. But of course, we think that they are also per se reducing some aspects of inflammatory signaling in the cells themselves as well.
Mm-hmm. So for some of the things we'll talk about, it sounds like this isn't just sort of a broad spectrum, hammer. It's not like the psychedelics are just turning down inflammation everywhere in all tissues. There's probably a lot of context and tissue specificity as to whether or not you see some of these effects.
That's a much more succinct way of saying it. Yeah, exactly.
And so, set up this paper for us a little bit. And let's start with the term psychedelic itself, because that's also a term that people have different views on. When
Yeah.
you used what psychedelics did you use? How are you using that term, and what are the specific drugs we're actually talking about here?
Yeah, so we used the term psychedelic because really we used it for simplicity, and we sort of state that in the paper. We appreciate that there's kind of different classifications depending on, the pharmacology or the structure of the compound and what receptors you're hitting. But really we considered we use psilocybin, which is the component in magic mushrooms. It's kind of what's considered a classical psychedelic because it's engaging the type 2A serotonin receptor. And then we also used MDMA, which is structurally distinct and also has different mechanisms of action. It's thought to, at least partially also be modulating serotonin signaling, but by a different mechanism. And, depending on how you can call it, you could call it an entactogen, empathogen, things like that.